Now we will talk about the ECG and the relations. ECG actually occurs before the atrial systole, right? The atrial systole occurs when there is, the electric changes in the heart, after which the contraction occurs. So electric changes will occur before the contraction, right? So P wave will appear before the contraction actually occurs. So P wave is present at the very beginning of the atrial systole, right? Now then we have the atrial systole. Now we can see, if I show you, we have the ventricular systole here. That is, the ventricle will contract from this point, right? From this line. So we can see, if the ventricle needs to be contracted, we need to have that electrical changes to happen before this. So we know that QRS complex is the electrical changes that depict the ventricular uh, depolarization, which will lead to the contraction. So before the systole we will have the QRS complex. So what we have done is that before the atrial systole we have P, and before the ventricular systole, that is isovolumetric contraction and rapid ejection and reduced ejections, etc. Before that we have the QRS, right? Now the T part actually denotes the electrical changes, that is the repolarization, so that the heart now is fully relaxed. So before the relaxation phase, that is before the diastolic phase, this phase, diastolic phase, we have the T wave. So before the diastolic phase we will have the T wave. Before the systolic phase we will have the QRS complex. Before the atrial systole we will have the P. Just at the starting we will have these three complexes, and this is easy, right? Last thing that you need to know is that the point R, this R point, you need to know that it lies just at the line when the mitral valve closes and when the S1 starts, right? This is the thing that you need to remember. If I compare it with the heart sounds, we can see that ECG, actually the P wave starts and the QRS comes, right? So at the time of QRS we have our S1, that is during the after the R point we have our S1, then we have the QRS, then T, then after that we will have our S2, S3 and S4, right? So S2, S3 will come after the T wave, and after that we will have our P wave. Here we will have our P wave, and then we will have our S4. So the sequence is QRS and the S1 sound, then T, then S2, S3, then P, and then S4. That's it.